district with a population of over 1,000 people. This small community-based health planning and services CHIPS Center is the only healthcare facility here. It has 3 small rooms for different consultation services and a sizable open space for a waiting area. Next to it is a small structure with rooms for the accommodation of 2 healthcare staff and an extra room used as a delivery room. Both pregnant women and nursing mothers come here for antenatal and postnatal services, but the facility has no access to water and no washrooms or toilets. Mary Ania has been coming to this facility for some years now. She received antenatal care and delivered her second child in this facility.
After I gave birth, because there's no water here, I have to send my sister to go home and carry and bring me water so that I can take my bath here. It's very far from here. So she went home and brought the water. So I took my bath and the midwife to take over. I went home and came back here with rashes all over my baby.
Like Mary, these 2 expectant mothers coming for antenatal care are facing similar difficulties due to the lack of access to water and sanitation facilities. They say they are not even able to collect their urine samples in a dignified manner for lab tests.
Hosan doba bottle so before te hodeke tam de leb kuril in so ngalaka bole nyela awon batata ba ho kalan to leb kurire ka so nye balala ma nan leb kuri o hobati yirma tuko wana to so balala me lawan tere selawande le yume de before to so nyela balala ma waka tarab ba aboro ho poro halame
first time ma wakala te inge we minga nandore zete te kador makumi masen ze kadore esalam de montenga oy to zel ze do nerva biro ko be ona sen kalili ze adore mambete ya hanye ne isornga bonito la bangradeko la sonto.
The healthcare staff here at the Kunkua CHIPS Center have to rely on kind community members who volunteer to bring them water for their hand-washing setups. Gifty Amo, a senior nurse here at the facility, explains that it is difficult to avoid spreading infections while working under these circumstances.
When I have a case and I want to wash my hands, I'll come here and pour the liquid soup to now wash my hands. And I'll now open the tap, wash it into this basin. So when it's now done like that, I have to carry this basin to outside to go and pour the water away. But in case the tap is not flowing, I have to use my soil hand to hold this cap and open the basin to fetch water, which is very bad because if I use my soil hand to touch this cap, that means I've contaminated the whole water, which is very bad because it causes infection because I've transferred bacteria into the water. So at the end, the whole water is not safe.
The story at the CHIPS Center in the neighboring Gori community is not too different. The healthcare facility was provided with a hand pump borehole. So, although there is a source of water supply, the water does not run through taps in the facility. Women seeking maternal healthcare services, therefore, must come to the borehole with buckets to fetch water before being able to use the washrooms. This structure outside is the urinal used by all clients at the facility. Inside the facility itself, there is a small maternity ward with a washroom attached. However, since there is no running water, the mothers or their relations accompanying them must go out to the borehole, which also serves part of the Gori community, to get water and bring it back to the ward for use. This exposes the mothers and their babies to the risk of infections. These two young women have once delivered babies here at the Gori Chips compound and are expecting once more.
So makanya ko wasala mam pokanya ko pe de yok biyela ta mo so biyela maka soli ta mo ara de Allah bila yom ba ti biyela yom berama so mayun do ba mayu kanya ko waso to mayun gamba la halen to yu yan kai him sanyan kulinde ya ta so iso ngala ko ana mi iso ngala mi kele foli kutsema akinzam lato anata bone inside and ni sinka door ba de flash.
Next, we visit the Biontankun community, also in the Bongo district. The healthcare facility here is also a community-based health planning and services CHIPS Center. It receives hundreds of clients daily, many of them mothers seeking maternity services. But this healthcare facility has no access to water and has no washrooms, toilets, or even a urinal. When the women here need to use any of these facilities, they must go to the nearby homes and hope to be permitted to use their facilities. Otherwise, they have to improvise by using a cloth to cover themselves and hide behind a tree or a rock.
When I was pregnant, it was very difficult. Water was the main problem. When we come and they give us the malaria drug, where to get water, it was difficult. Some of us, when we are coming, we don't have money to come and buy pure water. And we don't also know some people here, whether they clean their containers before fetching water or the hygiene they are doing in the house, we don't know. We'll go and just collect the water like that and come and take the drug. To wash our hands too, it was a problem. When we want to urinate, another problem.
For you to get urine for the test that you are pregnant, it's always difficult. So because of that, they normally hide until the pregnancy will show up before you come. Because if you come, where to even enter and do urine for the test is a problem. And we don't have toilet. If you come here and you are feeling like to free yourself, unless you go home.
Because of this situation, deliveries are not conducted here at the Biontankun Chips compound. The mothers come here for antenatal services until they are due for delivery. They then go to another facility in a nearby community to deliver their babies. The journey is often difficult and becomes treacherous during the rainy seasons because a large river separates the two communities. Irene Akologo, a pregnant mother, has already gone through this ordeal.
When I was to deliver first, it was not easy. I struggled. After crossing the stream, you have to cross a river again before we now get to the clinic. That place too, there was a lot of water. We normally go with our mothers. So they helped me to cross. The time I get there, I was weak. The time they were even saying push cry for the child. So when the child came out, that's what passed. The child couldn't cry. They said it has kept long. So the time for the baby to come out, it delayed. I was thinking that I even lost my baby. But God being so good, the child was alive.
The situation has not changed since Irene had her last baby. and now 5 months pregnant again, she will be due for delivery in August, the peak of the rainy season in this part of the country. She is likely to face the same ordeal she faced during her last delivery 2 years ago.
It's 2 years now, and I'm 5 months pregnant again. So as I'm here, as my previous time, even how to walk and go to the first where we get the water is far. The time you get back here, you are always tired. And to deliver, we have to go to Walka, which is far. Even if you are approaching to deliver, if you are up to 28 weeks, they have to send you to Walka so that you'll be going there to see the midwife, which is far. You cross the river, and walking like that is not easy.
The Namu Healthcare Center provides healthcare services to thousands of people in the border town of Namu, here in the Bongo district of the Upper East region. In addition to regular outpatient services, maternity and child welfare are the predominant services provided in this healthcare facility. On average, 40 women come here daily to receive maternity services, and a minimum of 35 newborns are delivered here every month. However, wash facilities here are not commensurate with the high number of clients. Although there is a borehole here providing water, only the maternity room of the facility has washrooms and a toilet. The physician assistant here at the Namu Health Center, Halima Sadia Adamu, explains.
And at the maternity unit, we can receive about 30 or 40 mothers a day. Some will have to also produce urine for testing for the ANC clients. The postnatal clients, some of them will also have to use the washroom. And at that unit, we have only 2 urinals and then the toilet. And so with these 2, with the population, I think there's an impact of the 2 toilet and then bath facilities. We don't have a place to wash hands, and you need to wash your hand before you pick your baby, or after delivery you have to wash your hand before you can breastfeed your child.
Regular clients, both male and female, are therefore forced to share this washroom, which was a storeroom before it was converted into a place of convenience. The women say there is no dignity using this washroom.
This is my 4th pregnancy, and all of them, it is here that I've delivered in this facility. I would say it is not good at all. My previous bed before this one, there were about 3-4 people who delivered on the same day. To use the bathroom, it was a challenge because it was one, and sometimes the water doesn't flow frequently. You have challenge with the water shortage, and here the case is even one which you cannot even use. Aside that, the washroom is only one in the antenatals and one outside. And looking at the population in this facility is large. When it is one, you are going there to use it. Another person may also want to use, not the same gender. It causes inconveniences there.
Daratala white bottom because I mark what do yes to Kemka do on your white, on your bass zo. Yerala's in Alankabola, or my power at a Betty ye kadu retumumbo, Zinsakatba way, Latana part with the do and do. To Kem to Kadura, Okaya Konkabom to young flash at Lazoyes, so Banetta do me laughing at any laying.
The physician assistant says some of the women sometimes pick up infections as a result of the situation with the wash facilities.
Yeah, because we have only 2, some of them will have to go outside to produce the urine. And when after producing the urine, if they don't wash their hands, definitely they go home and touch other places, they will go home with infection. One, there's no wash facility for the clients. And even the staff, is not enough for the staff. Definitely, if they come to the hospital and they don't wash their hands properly, they can easily go home with infection.
sharp contrast, however, women at the Atampintin community are often full of smiles when they are seeking maternity services at the CHIPS Center there. This wash facility, provided by WaterAid Ghana for the CHIPS Center, comprises a mechanized borehole that provides running water, decent toilets for males and females, and hand-washing facilities. The borehole also provides running water to the healthcare facility. About 4 years ago, the situation here was similar to that of the Gori CHIPS Center. A community hand pump borehole was the nearest source of water, and the healthcare staff and clients often had to compete with the community members in long queues to get water for use at the CHIPS Center. Elizabeth Akalari had her first baby here at the Atampintin CHIPS Center. At the time, this wash facility had not yet been provided.
My power and clinic in 2022. Manta and became a poor. More and color face. How to any odore. Lede yele biko ko nkabo. Seto behe pumping buzi. How to eng bangera. Seto kem behe. Honye tia be bokan lenzi ka eng bangera.
Elizabeth is pregnant again, but this time she is always excited to come to the healthcare facility because she does not have to worry about decent water, sanitation, and hygiene facilities.
Oh, so no bona because Lord de pupil le manya nye kuna. Because first na my midwife for Melissa in the ku mama na akale mel hebala. So Lord de pupil mama. First na handor ba se to gura han kuli to kaso belele zo handor ba ho yang sokal de yang kuli wo yang pe ho lo la to de kido kala de yang kuli so lo de pupel zozo.
Like Elizabeth, other mothers who come to the Atampintin CHIPS Center appreciate the dignity they enjoy when they want to collect their urine samples for lab tests or just attend to nature's call.
You man nungar ma yon tarapura ti yonan katare kunzia kala la yondele pumping de ti read about so minute borehole ti community les na wa ti ngiliga yeles na wa yola agra la bila wala ara bahti mara do ko hin ko mbile mbile ti na pege mengala makayanda pe mingala want zila ba sabra da kume da tamma mingala lan lorla de le de ki mbuyi point maklan do ka buyi point la nde masin na hangarwa na da de minna na yira ku la point.
For the healthcare workers here, their job is made easier with the supply of running water, and so they provide quality maternal and other services to the clients. Judicia Atampintin is in charge of the Atampintin CHIPS compound.
It was time consuming when this ANC clients, when any of them is in labor and comes, we have to still go and fetch the water and render services. If it is during delivery, if there is nobody, a relative who accompanies the client to the facility, is the midwife that will fetch the water, come back, and then before she will render services. You see that it's time consuming. So with the implementation of this wash fits program by WaterAid, it has brought a lot of improvements. In addition, sulfadoxine pyrimethamine, it is a malaria drug that is given to the pregnant women at 16 weeks. That one, they don't take it in the house. They have to take it before the midwife. So with the water available, it makes them comfortable to fetch and to drink. And then with the hand washing, we just open the tap at any point in time that it's necessary for us to wash our hands. And during delivery, the midwife also feels comfortable whether there is somebody to fetch water for her or not.
According to the Bongo District Director of Health Services, Estella Abazese, many of the healthcare facilities in the district were built without the provision of proper water, sanitation and hygiene wash facilities because they were not intended to admit patients or for complex procedures such as delivering pregnant mothers.
Basically, it was because they were constructed not to offer detention services. So we have CHIPS facilities like Kunkua, Bintanku, and a host of others that do not have wash facilities in them yet. We are forced to render delivery services in these communities. So it is so difficult.
She said this has created a situation where mothers and newborns are often discharged only to return a few days later with infections like sepsis.
So we've had situations, we deliver children, neonates, send them home, and within the next 2 days they are back at the hospital with sepsis. And we can't rule out the possibility that our infection control practices at the facilities without water is challenging and surely will have an effect in the spread of infections.
The Bongo District Director of Health Services acknowledges the work done by WaterAid Ghana in providing water, sanitation and hygiene facilities for the Atampintin CHIPS compound and other healthcare facilities within the district. She says WaterAid Ghana has made a big difference.
WaterAid has been one of our great partners when it comes to wash services in Bongo district, and we've been working with them for over 10 years in Bongo, and the impact has been great. It has been life-changing for many of our facilities. If you look at the health center level, for all our health centers now, we have mechanized boreholes with water flowing at service delivery points. We have incinerators for waste management for all the health centers that we have in Bongo. And we do have toilet facilities for our staff and clients. And then when you now look at the CHIPS level, those CHIPS that also offer maternal and child health services, especially delivery services, WaterAid has moved on to these facilities now, also providing wash facilities for them. And so the impact has been great.
So, why all these interventions in the Bongo district by WaterAid Ghana? Ibrahim Musa is the head of strategy, policy and campaigns at WaterAid Ghana.
The WHO UNICEF Joint Monitoring Program statistics indicate that as of 2021, the whole Ghana, only 67% of healthcare facilities have adequate water. Only 67%. And I can tell you in confidence that of these 67% of healthcare facilities that have water, a chunk of them are in urban, which means that there is serious inequity for rural. If you were to break these statistics down into urban rural, then you will see the situation of rural, including Bongo. We shouldn't forget that Bongo is one of rural districts in northern Ghana. And the fact that even government policy-wise, northern Ghana is considered a deprived geographical area, and Bongo is also one of the highly deprived districts in Ghana. Your guess is as good as mine. Within these 67% that we are talking nationally of healthcare facility with wash, you can imagine Bongo statistics. If you come to sanitation, just barely half in the whole country of healthcare facilities have adequate toilets. And even when we talk about adequate toilet, we are talking about toilet facilities for male and female, because for water aid, we are very concerned about gender responsive wash. You know, different for male, different for the unique needs of women. When it comes to hygiene facilities, just more than 50% of healthcare facilities in Ghana have adequate hand washing facility, which is very important because every step of the way in any healthcare facility, hand washing must be there, which means in rural areas like Bongo, the situation can be dire.
The efforts by organizations like WaterAid Ghana will only amount to a scratch on the surface if the government does nothing to complement their work. The call for the provision of decent water, sanitation and hygiene facilities in healthcare facilities in the Bongo district, which translates into more dignity for mothers and their newborns, has never been more urgent than now.
We appeal to the authorities to help us with facilities like the washrooms, the toilets, the bath and water. As well, if we even build the toilets and the washroom and there's no water, it's still going to give us problems.
We can't be suffering like that, so we are pleading that if we get water here, it will help us a lot.
So the suffering I went through because of water and the facility, I would like to plead that if they can help us get all those things for us, we will be happy.
WaterAid Ghana has this call to action.
Number one, the need for Government of Ghana, Ministry of Health, Ghana Health Service to prioritize wash and healthcare facility. When adequate wash is provided in healthcare facility, doctors find it easy, nurses and midwives find it easy to deliver quality of care to women, children, and all that. Number two, when wash is prioritized in healthcare facility, infection prevention and control become easy, to manage. And significantly also, we want to call on the Parliamentary Select Committee on Health to adequately resource Ghana Health Service and Ministry of Health through government budgetary allocations. The important thing is to release the money. Once the monies are released, we also want Ghana Health Service to take steps to ensure that rural areas like Bongo district, Kunkua and other chiefs that you visited that do not have wash, they should prioritize and give them wash facility. And finally, we also want to call on development partners, funders, philanthropists, rich people who have money to come to the aid of these communities that run healthcare delivery without adequate wash, because women dignity needs to be promoted, women dignity needs to be upheld in the course of delivery.
For now, mothers at Kunkua, Gori, Biontankun and Namu will have to continue visiting their healthcare facilities where they cannot attend to nature's call without sacrificing their dignity, where they struggle to get water and end up exposing themselves and their newborns to infections.